Hi guys, this is Dr. Dave with Renew Concierge Physical Therapy in Pensacola, and today I want to continue with my weekly wins series. And today's patient is a woman who came to me with pretty significant left knee pain. She had been actually getting treatment from another practice here in Pensacola, but very little results. And so she wanted a second opinion. And by the way, I always recommend a second opinion. If you're not getting results within 3 visits with your physical therapist, get a second opinion. I'm not saying they're bad. It might just take a while. That would be fine. However, second opinions, people get them all the time with physicians. There's no reason why you shouldn't get it with a doctor of physical therapy as well. And so in any case, she came to me for a second opinion with her knee. She was diagnosed with a meniscus tear, and that is what I also diagnosed her with. It was a meniscus tear. The question is, why wasn't it healing? Why wasn't the therapy working? And I did ask her, does she have back pain? She goes, oh, yes. And so I asked her, I'm like, would it be okay if I just treated your back first? And she was willing. And the main reason why I did that is because the pelvis, to me, is the foundation of the body. Just like a home, when you build it, needs a level and strong foundation, your extremities need a strong and level pelvis foundation. And it's not just the pelvis, but the lower back as well, the lumbar spine. Things need to be working well in that area in order for the extremities to heal properly, and a lot of times. Even if you're not having back pain, sometimes that could be the root of your pain because of the mechanics. I mean, the hip bone is connected to the knee bone, okay, guys? And that's the same principle that I use on a regular basis as my investigative physical therapy practice continues. It has to be looking at every part of the body. And that's why I offer 75-minute visits to start my sessions. You're not going to find everything you need in 20 minutes in a traditional physical therapy clinic. And so what I did was, I evaluated her knee, but I also evaluated her back, and I did find some issues. She did have some pain. I corrected her problems. I improved her range of motion. I reduced her pain. When I was done on my first visit, no pain in the back, full range of motion. She felt great. The problem is the knee didn't really change too much. She goes, yeah, my knee feels about the same. I said, okay, no problem. I'll see you next week. She comes in to see me for my second visit with her. And she goes, what did you do to me? It's like night and day. My knee barely hurts me. And I told her it's because the back was causing inappropriate tension and inappropriate mechanics into the knee that wasn't allowing the knee to properly heal. Now, her knee did not heal in 1 week. There's still a meniscus tear. But what we do know is that the knee's meniscus was getting inappropriate tension and inappropriate force through it because of the back. Now, maybe the back was directly affecting it, or maybe it was because she was walking differently and she had a disruption of her gait pattern because of her back hurting so much. And you know, we don't know everything in physical therapy. What I do know is that back certainly had a lot to do with the knee pain. And so in any case, now that I've got her started on a proper program, you know, her hip and pelvis is going to be completely fine, and her knee now has a foundation for proper healing. And my physical therapy with her is actually going to be quite effective. And so in any case, she's a few weeks away of being back to normal. It does take time for the meniscus to heal, but in her case, she's quite happy. She's mostly pain-free. There's certain things she can't do, but we're going to work on those with her. And so in any case, I hope you enjoyed this testimony. Again, if you're not having the kind of results that you think you should have with your pain syndromes, give Renew a call, and we'd be happy to come out and take a look at you and get you that second opinion that you need and deserve. Have a wonderful day.